Good morning, everyone. Welcome again to the today's session and today's webinar for the NIH's COVID-19 webinar series. Today's topic is COVID-19. What are the responsibilities of the employers? And we are going to do an update of this particular topic, given the many developments, both I think in the legal frameworks and the regulations and guidelines, as well as the general context within which we are doing our activities today. So, welcome again to this NIH, National Institute for Occupational Health webinar. The National Institute for Occupational Health is a specialized division of the National Health Laboratory Services, the NHLS, an sister division of the National Institute for Communicable Diseases, the NICD. And this is now, I think, exactly a year that we've been doing these, more than a year that we've been doing these webinars, and we've dealt with multiple topics on the area of COVID-19 as an occupational hazard, as an occupational concern within the workplace. And in order to support you as the stakeholders of the NIH, the attendees of our webinars, in ensuring that we can strengthen COVID-19 workplace preparedness and prevention. So it's all the stakeholders and all the role players, from the health and safety rep to the health to supervisors and managers, the employer itself, and those specializing in health and safety, the health and safety officers, the health and safety technicians, the health and safety agents also in the construction sector, hygienists, the occupational medical practitioners and occupational health nursing practitioners, etc. The environmental health practitioners, everybody that plays a role insofar as the prevention of exposure to a bug, a disease, the COVID-19 SARS-CoV-2 a particular virus. Okay, so having introduced you to this as a reminder, you must please visit the NIH's website. Our website is 0 rated by all the major mobile cell phone service providers, and therefore you will not be charged data if you visit our website, and you can download a host of COVID-19 and other occupational health and safety information, and COVID-19 resources. Okay, so all of our webinars are recorded, and these are made available via the email that you receive after the webinar. It's on our website, and the full video would also be on the YouTube channel. Having said that, let us quickly get to the program. And so, unfortunately, Dr. Tanusha Singh is not available for today. She is the chairperson of the COVID-19 Occupational Health Outbreak Response Team, the OHOT team here at the NIH. And I have, on her behalf and the behalf of the NIH, done the welcome. And so our program is dealing with introduction to and setting the scene for our program today, in particular, given COVID-19 and the most recent and latest developments. We are going to have Dr. Graham Chin, who is from the NIH's SHE department, that's the Safety, Health and Environment department, and this department services the whole of the National Health Laboratory Services. This is the national office. Our second speaker is Michelle Morgan, and she's going to deal with legislated roles and the responsibilities of the employers. That's followed by, apologies, Michelle Morgan is also from the, she's the deputy manager of the National SHE department, a colleague of Dr. Chin in that particular department. Our third speaker is Karen Dupree. She's an occupational hygienist from our occupational hygiene section, and she'll deal with what the employers need to implement in response to COVID-19. And then our final speaker is Dr. Jan Lapierre. He's an occupational medicine doctor, and more, in addition to that, he's an independent occupational health and safety consultant with a specialization in social labor law. And Dr. Lapierre has this unique combination of occupational medicine practitioner with somebody who's got a very strong understanding of the labor law or the legislation that deals with this rights and responsibilities. And Dr. Lapierre is going to deal with the employer's COVID-19 containment practice and deal with all of what he has been able to gain experience in the outbreak of the COVID-19 epidemic within our country, within the broader pandemic in the global context. And so by way of introduction, I'm going to ask Graham just to use the share function and share his slideshow and maximize that for us. And by way of introduction, oops, what just happened with, oh, there we go, I found it again. So Dr. Graham Chin is an occupational medicine practitioner, as I've mentioned, currently working for the National Institute for Occupational Health, the NIH, as part of the Safety, Health and Environment Department, tasked to service the broader National Health Laboratory Services, and that I've mentioned to you. I've been working as a full-time as an occupational medicine practitioner since 2010 in both private and public sectors across various industries, and these industries includes mining, construction, waterworks, automobile, manufacturing, machinery, food and catering, and the corporate sectors. And over the last few years, Dr. Chin has dedicated himself to the public sector, trying to improve laboratory-related occupational health and safety. And with those very few words, I want to thank you for availing himself out of his busy schedule. He has more than 7,000 stakeholders within the NHS as employees that he supports and assists with his team. I hand over to you, Graham.
Thanks, Ashraf, and morning, everybody. So once again, thank you for the opportunity to present to you. I was tasked to give the introduction to this webinar. What are the responsibilities of the employer? And as Ashraf has mentioned, we've got some very, very good speakers, very experienced speakers coming up that I think will deal a lot more in detail around exactly those responsibilities. So I thought by way of introduction, it would be nice to just ease everybody in, and maybe let's go through the timeline of COVID-19 in South Africa, because I think it highlights some of the important points that have gone through in South Africa, and how it's affected us as workplaces and how we practice our occupational health. And it would be nice to just highlight to people to look back and see everything that has occurred. So take yourself back, March 2020. We're literally a year and just a little bit over now. 1st of March, the South African tour group returned from Italy. And a few days later, somebody developed symptoms. And on the 5th of March, the actual first confirmed case of COVID-19 in South Africa was announced. 38-year-old male who tested positive in KZN. Literally 2 days later, from that same group of travelers, a female was confirmed to be positive, and that took us to the 7th of March. By the 11th of March, 6 new cases were reported on that day, and there was one of those cases was from that travel group, so you can see a lot of those people that came in were infected. But interestingly enough, 5 of those cases that were reported on the 11th had no travel history, and specifically from the European countries. And if you take yourself back and were following the media, especially the global media at that stage, there were a lot of COVID cases that were being diagnosed in Europe, the Americas, the East, etc. Also on the 11th of March, the WHO then declared and confirmed that this was a pandemic. It was affecting so many countries globally, and we still experience that devastation up to this date. By the 14th of March, the Western Cape reported a teenager who tested positive. Up until that stage in South Africa, I think there was around maybe between 24 and 30 cases. Most of those cases were people aged above 30. So that was a real interesting finding at that point in time, that someone below 18 years old was diagnosed with COVID. By the 15th of March, President Ramaphosa declared a national state of disaster, and he brought into some very significant changes. There were travel restrictions imposed, and schools were instructed to close. On the 17th of March, the first confirmed local transmission cases were announced. Up until that stage, it was thought that most of the cases were imported, and that was a significant announcement, because we know local transmission was always going to be the concern. Then on the 23rd of March, the president announced the lockdown, which was due to start on the 27th of March. We will forget the infamous Thursday midnight. It was unpleasant, and really what the implication was only that essential services and business were to continue operating. There was no alcohol or cigarette sales permitted, and citizens were not allowed to travel or attend any gatherings. It was a really tough time, and this hard lockdown, as they called it, the level 5, was to last for 21 days. By the 27th of March, we had our first COVID-19 death reported in South Africa. And by the end of the month, we had 1,353 confirmed COVID-19 cases. And as you can see, within literally about 3 weeks, 4 weeks, from one case, there was literally a 1,000-fold increase in cases. April was a tough month because it really implied it was about the lockdown. Businesses were closed. In metros, it was like a ghost town. Slowly through that, on the 1st of May, there was gradual easing of the lockdown restrictions, which moved to level 4. By the 1st of June, the restrictions were then lowered to an alert level 3. But by that stage, South Africa had around 151,209 confirmed cases, and unfortunately, just over 2,600 deaths. Interestingly enough, more than 1 million COVID tests had been performed up until that time. Sadly, by the 9th of July, that was the highest number of confirmed infections in one day recorded, 13,674 in one day. By the 17th of August 2020, restrictions were lowered to level 2. We started seeing tapering of the so-called first wave. And by the 21st of September, the restrictions were lowered to alert level 1. However, once again, at that stage, we had passed 500,000 confirmed cases, and there were more than 15,000 deaths in South Africa. Come December, we know that was the real worry, because with so-called holiday period coming into play in South Africa, on the 9th of December, the Minister of Health announced that South Africa had entered its second wave. There was lots of cases that were being diagnosed again, sort of early December, late November. And by the 18th of December, the Minister made a second significant announcement, which was that there was a discovery of the new variant of the coronavirus, the 501YV2. And that turned everything around again, just as we thought we were getting a grip on things. By the 27th of December 2020, South Africa had reached 1 million cases, confirmed positive cases. And given the increase in incidence at that point in time, the lockdown was tightened from an adjusted level 1 to an adjusted level 3 on the 29th of December 2020. Most people will recall all the beaches, etc., were restricted areas. Yeah, it was not a very happy time. Then came the new year, new hope, hopefully. On the 3rd of January, the Minister of Health revealed the South African COVID-19 vaccine strategy. A lot of hope was pinned on the vaccine. In sort of the 2020, even when COVID started, there's always talk about strategies to try and curb infectious diseases, and vaccines was one of them. So, in the new year when it came, there was this hope that we could use a good vaccine strategy. And like I say, on the 3rd, it was announced, and the aim of that was to try and immunize 67% of the country's population to try and achieve herd immunity. By the 1st of February, the first batch of Oxford AstraZeneca vaccines were received, and there was much excitement. I think there was a lot of hope that was given. And unfortunately, on the 6th of February, the report started to emerge that the provisional trial date of the Oxford AstraZeneca vaccine seemed to show reduced efficacy towards the 501YV2 strain, which at that stage was the predominant circulating strain in South Africa. So literally on the 7th of February this year, the minister then suspended the rollout of the Oxford AstraZeneca vaccines, and that was almost around 1,000 doses. And I think it was really a trying time for South Africa. However, come the 17th of February 2021, there was an announcement that the national COVID-19 vaccination strategy would still proceed, although it would be run through the Sisonke program, which was using the Johnson & Johnson vaccine, the AD26 COV2S vaccine. So once again, the strategy involved trying to vaccinate healthcare workers, and specifically those healthcare workers at most risk. And really by the 1st of March 2021, there was once again easing of restrictions from an adjusted level 3 that was implemented, remember, in late December, to an adjusted level 1. Once again, unfortunately, we had surpassed the 1.5 million mark of confirmed cases, and our deaths were sitting at 52,846. Just literally within this week, on the 13th of April, it was announced that the Sisonke program has just been temporarily suspended as a precautionary measure to allow for further investigation into the vaccine. And this came on the backdrop of 6 cases in the US reporting a very rare potential clotting side effect coming out of approximately 6.8 million persons that were vaccinated. So we're somewhat waiting for further information around what's going to happen there. And virtually on the same day, the Minister of Cooperative Governance and Traditional Affairs signed that there is an extension to the national state of disaster, which will now be extended to the 15th of May 2021. So, that's a quick rundown of some of the highlights in the calendar year that has passed, and it's amazing to look back to see what has happened, and how COVID has changed. I've taken the statistics from the South Africa coronavirus website, which is really a great resource to sort of track numbers, etc. And you can see that we've had over 10 million tests conducted. Our positive case load is still sitting above 1.5 million cases. Yes, we've had recoveries, but look at our death rate. We've had 53,498 deaths, and that really is sad. Having said that, on the Sisonke program, our vaccinations are standing at 292,623 vaccines that have been administered. We're waiting to see how that's going to change. And, COVID is still here, unfortunately. I've put this graphic in that was taken from the NICD website to just illustrate once again the first and the second waves. It's a little dated, this trend graph, because it sort of just accounts towards the end of February. But like I say, March has sort of seen a tail end. And I think the big question is when is the third wave going to happen? Is it going to happen? There are some drivers, but it's extremely difficult to predict, especially having spoken to some epidemiologists. It's not easy to say when this will occur or not. Okay, so, having taken that just historical walkthrough, I think that sets the tone of where we're going. And once again, I think the important thing is, as you can see, information changes continuously over time. Just when you think that something's happening, it can literally change within the same week in which you read it. So make sure you stay up to date, make sure you get credible information, go to the websites that have good data, etc. And I've listed these websites, and this presentation, once again, will be posted on the NIOH website. If you need to get the website for the information here, they are listed here. And stay ahead, because I think this game is changing ever so quickly as much as we're starting we think we're getting a handle on it. Ashraf, I think I'll just end there. It's a short introduction, but I think the colleagues coming after me will really delve now deep into the employer responsibilities.
Thank you very much, Dr. Graham Chin, who is the occupational medicine practitioner in the SHE department of the NIH, servicing the National Health Authority. Thank you for that appropriate introduction, setting the scene for our next speaker. Just a quick admin announcement. I'm going to ask our attendees, and that includes, I think it's Ponso and maybe Bisisiwe. The raised hand function is not operative for this particular webinar. We have too many people to engage you in a direct audio conversation. Please type your general comments in the chat box, and or type your questions for the presenters in the question answer box. And those icons are at the bottom of your Zoom screen. You will see the Q&A with the two bubbles there, Ponso, and you will see next to it the singular bubble, speech bubble, with the word chat below it. Use those two channels to make your general comments or to type your question and answers. Our next speaker is Michelle Morgan. She's the Deputy Manager of the National SHE Department within the NIOH, servicing the broader National Health Laboratory Services, the NHLS. And Michelle has already shared her slides with us. We'll be dealing with the legislated roles and responsibilities of employers. If you could maximize your slides, would be great, Michelle. And now I just quickly need to get your bio out, and I forgot to open that. I found it. Okay, so as I've mentioned, Michelle is the Deputy Manager there in our SHE department, and she holds qualification experience in the Diploma of Biomedical Technology and Virology, and has 15 years medical laboratory experiences. A bachelor's degree in environmental health with 14 years SHE experience, that's safety, health, and environment experience, and 11 years in a senior management position within a SHE function, health and safety function. The many other aspects of her qualifications includes SHEMTRAC, the ETDP CETA's trained facilitator, skills training, leadership management and skills training, but most importantly, I think the development of numerous health and safety training courses for our health and safety reps throughout the National Health Laboratory Services, apart from the many other projects that the SHE department have undertaken. And I'm going to stop there because there's much more to share with you, and hand over to Michelle to start her presentation. Michelle, thank you very much for making the time to join us today and share your experience and knowledge again. I hand over to you.
Thank you, Ashraf. Good morning, colleagues. Thank you for making the time to attend this presentation. Ashraf has given a good background description with regards to my roles and responsibilities, and I'm going to present on legislated roles and responsibilities of the employer when it comes to occupational health and safety. So I will begin by introducing to you the OSH Act, which is the Occupational Health and Safety Act. It came into effect on the 1st of January 1994, and it has 50 sections and various regulations. This is just what the front page of the OSH Act looks like. And it was published by the Department of Employment and Labour. And as you know, one of their functions is to regulate the South African labour market through inspections, compliance monitoring, and enforcement. Therefore, every workplace is required to comply with the OSH Act. The aim is to provide for the health and safety of persons at work, the health and safety of persons in connection with plant, the use of plant and machinery, the protection of persons other than persons at work against hazards to health and safety, and to establish an advisory council for occupational health and safety. As I mentioned before, it applies to many workplaces besides mines and mining areas, load line ships, fishing boats and sealing boats, cranes, and people in these areas or vessels.
Michelle, sorry for interrupting. There's a comment by Temba Dlamini saying that you're not audible enough. If you could perhaps move closer to your microphone on your device, would be great. Sorry for interrupting.
Okay, no problem, Ashraf. Just tell me if it's a little better. Okay, if you are familiar with the OSH Act, you would have come across the words reasonably practicable. So basically what this means is practicable, having regard to the severity and scope of the hazard, the state of knowledge reasonably available concerning the hazard, the availability and suitability of means to remove or mitigate the hazard, the cost of removing or mitigating that hazard. So in other words, it is doing what you are reasonably able to do to ensure the health and safety of workers. So I'm not going to go through the entire OSH Act and all the sections, but I've selected the most pertinent sections with regard to the workplace. So I'll begin with section 7. So section 7 is the health and safety policy. It is a written statement of principles and goals embodying the company's commitment to workplace health and safety. It includes briefly a description of the organization and the arrangements for how it will carry out reviewing this policy. This policy statement needs to be prominently displayed at all workplaces, signed by the CEO, and it must have a review date. Moving on to section 8, general duties of employers to their employees. Every employer shall provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to the health of his employees. So basically what this involves is providing systems of work, plant and machinery that is safe and without risk, taking steps to mitigate or eliminate hazards or potential hazards, making arrangements as far as reasonably practicable for the safety and absence of risks in connection with the work, establishing what hazards to health and safety are attached to work, and what precautionary measures should be taken in respect of the hazards. Further on, duties indicate providing instructions, information, training, and supervision to staff for their health and safety and for the health and safety of other staff, and not permitting an employee to do any work without taking precautionary measures that have been prescribed by the company. General duties further indicate taking necessary measures to ensure the requirements of the OSH Act are complied with by every person in the organization. Enforcing the measures, that is making sure that it is implemented and put into practice on the ground. Ensuring that work is performed and plant or machinery is used under general supervision. So if you look at the last few slides, you will notice that I have highlighted the word safe, risks, health, reasonably practicable, hazard, safety, health, safety, risks, health. You'll find that all of these revolve around a risk assessment. So a risk assessment is the foundation on which the health and safety unit would determine the risks in an organization and they would identify the hazard, and then assess the risk associated with each hazard, and then take steps to put control measures to eliminate, that is, get rid of it if they can, or mitigate or control the risk. And ultimately, the purpose of the risk assessment is to protect the health and safety of the worker. So every workplace, according to the OSH Act, be it a hospital, a lab, an office, a workshop, they must have a documented risk assessment in place. The risk assessment must be valid. In other words, it must be signed and dated and fall within, in other words, not be expired, because you will see one of the regulations states that it must be done at least every 2 years. For each identified risk, appropriate control measures must be selected and implemented, and the approved, facilitated, and satisfactory risk assessment must be communicated to all staff. In other words, it's pointless having a risk assessment that has been perfectly done in detail and filed in the manager's office, and that's where it stops. Then there's no point in doing the risk assessment. And the best practice is to make sure that staff are familiarized with the contents of the risk assessment. They understand what's its purpose, why it's there, and how to apply it. This is just a slide that shows you how the control measures need to be implemented following a risk assessment process. Moving on to section 14, which is the general duties of employees at work. Employees, that is you and me, must take reasonable care for the health and safety of yourself and other persons who may be affected by your acts or omissions. As regards any duty, you must cooperate with your employer. You must carry out any lawful order given to you. Obey health and safety rules. Obey warning signs. Obey instructions given. Because as an employee, you have actually accepted the conditions of the workplace. And as such, you need to comply with any health and safety rules and regulations. If you find that something is unsafe or unhealthy, and somebody brings it to your attention, Make sure that it's reported as soon as possible to the employer. Here, the employer may be the manager or supervisor, or you can go to the health and safety rep. General duties further, if a person is involved in an incident which may affect his health or has caused an injury, he must report this to the employer or to the health and safety rep. You can report it to both of them as well, and it must be done as soon as possible and preferably before the end of that shift. Moving on to section 16, the Chief Executive Officer is charged with certain duties. Every CEO, as far as reasonably practicable, must ensure that the duties of his employer in this act are properly discharged. However, a CEO may not be able to ensure this for, let's say, for instance, NHLS, which has in around 8,000 to 9,000 employees. So there should be a system in place where these duties are then assigned to other senior executives and managers within the organization. So basically a CEO can assign duties to his senior managers, his executive directors. They can in turn assign duties to section managers or heads of departments, etc. As long as the structure is written out somewhere and shown, so that when labor comes to inspect, you can explain the structure that is in place. The section 16.2 appointment is one of the legal appointments that Department of Labor would look at. Whilst the CEO can assign or delegate these duties, it must be maintained and remembered at all times that the CEO is ultimately responsible and will be held accountable should something drastically go wrong. Moving on to section 17, that is the health and safety reps. So who should have health and safety reps? So the act says that an employer with more than 20 employees must at a workplace appoint health and safety reps. This appointment cannot be just verbal. It must be made in writing, and it must be for a specific period. In other words, you cannot just appoint an health and safety rep as soon as he gets employed by the company and then tell him that, you know, he's the health and safety rep forever and ever. It doesn't work like that. It needs to be a specific period that you have these cycles of reps. It needs to be shared amongst other employees, and it needs to have a specific period so that you can ensure that within that period the person is trained, the appointment is in writing, and they conduct the duties and they know what their functions are. Who is eligible to be a safety rep? It is only a full-time employee, and it's only somebody who is fully acquainted with the conditions and activities of the workplace. Further on, section 17, how many health and safety reps should there be? For shops and offices, there must be one for every 100 employees. And for other workplaces, there must be one for every 50 employees. So any other workplace besides a shop and an office must have one for every 50. So a clinic, a hospital, a lab must have one for every 50. Remember, these are the conditions required by the OSH Act. Companies have the authority to make it a regulation or a policy within the company to have one health and safety rep for every single department, irrespective of the number of employees there. So there can be 5, but you will say, I want one for every department. So you can, in other words, you can go more stricter than the OSH Act, but not less stricter. When activities conducted, activities must be conducted during ordinary working hours. So in other words, a manager cannot say to you, you have work to do, and I cannot understand why you busy inspecting the workplace whilst there is stuff to manufacture here or tests to be done. They need to understand that the health and safety rep is serving a function for their department. The health and safety rep must be fully supported and must be given enough time to do their work, that is work dedicated for the health and safety rep. And the manager also must understand that although they have a safety rep, they are still accountable and responsible for their section of the workplace. So ideally, a section 16.2 appointment should be made for managers in different departments. Moving on to section 18. Section 18 is the function of the health and safety reps. Here they review the effectiveness of health and safety measures, identify hazards and major incidents, examine the cause of hazard incidents at the workplace, that is like an incident investigation. They investigate complaints by employees. They inspect the workplace, like I mentioned, safety inspections. It's a requirement by the OSH Act. And they participate in consultations with the inspectors. They receive information from inspectors, and they are responsible to attend health and safety committee meetings. Health and Safety Committee, Section 19. When must a committee be established? A committee must be established when there are 2 or more health and safety reps for a workplace. However, as I mentioned before, you can make it compulsory that every workplace has a health and safety committee. In other words, you can go stricter than the Act, not looking at how many reps there are, you're just saying that there must be a committee. How often must the committee meet? The committee must meet at least once every 3 months. In other words, they'll meet in January, February, March, April, they should meet again. May, June, July, they should meet again. So it's every 3 months by law. Health and safety committees. Who are members of the committees? So it will be all the appointed health and safety reps of that workplace. It will be persons that are nominated by the employer, to sit on that committee. And ideally, there must be one representative from management with the authority to act on behalf of the employer. There must be representative or representatives from a registered trade union and advisory members by reason of their particular knowledge on health and safety matters. Moving on to section 20, functions of the Health and Safety Committee. Make recommendations to the employer regarding any matter affecting the health and safety of persons at work. Where these recommendations fail to resolve the matter, you may make recommendations. You as a committee may make recommendations to an inspector. Discuss any incident at the workplace where a person was injured, became ill, or died. Keep a record of each recommendation made to an employer. As I mentioned earlier, you as a company or organization can take it 1 or 2 steps further. You can decide in your safety policies that you want to discuss every risk assessment at the committee. You want to discuss personal protective equipment at the committee meeting. You want to discuss evacuation procedures, evacuation drills, first aid, fire. These are things that you as an employee have the authority to do. So it's not that you are stuck to what the OSH Act tells you. You can do more that is applicable. Section 24, it is reporting to the inspector regarding certain incidents. In section 24 of the Act, you will notice that if these incidents are listed as incidents whereby a person dies, becomes unconscious, suffers the loss of a limb or part of a limb, or suffers permanent defect. Where any major incident occurs, where the health and safety of a person was endangered, where a dangerous substance was spilled, uncontrolled release of a substance under pressure, where machinery failed and flew out of control, or falling off, or uncontrolled movement of objects. So it's basically the major incidents that cause major illness and injury. So these are section 24. They need to be reported immediately to the Department of Labor. There is an annexure form that needs to be used for this purpose. Moving on to some of the regulations, as I mentioned, in the OSH Act. Firstly, the General Safety Regulations. These deal with issues such as PPE, safety equipment and facilities, things like providing your employees with gloves, overalls, rubber boots, visors, helmets, etc. So you as the employer is responsible to provide, maintain, clean, and train the employee on how to correctly use this. You're also responsible to ensure that you supervise your employees and ensure that they are wearing this when they are working. Intoxication is another issue under safety regulations. There must be a system in place to not allow employees that are under the influence of alcohol or drugs to the workplace. There must be warning signs prohibiting unauthorized entry. There must be a security entry process or procedure at your main gates and entrances, etc. First aid, emergency equipment and procedures. Here you need to have first aid kits according to the General Safety Regulations. You need to know how many kits to have. All that equipment information is provided in the GSR, General Safety Regulation. How many kits, how many people trained as first aiders. You need to ensure that you have eye wash stations in certain workplaces where there's a possibility of eye infection or injury. You need to have safety showers. You need to have firefighting equipment, etc. Moving on to general administrative regulations. Here it talks about the copy of the Act. How many people must you have to ensure that you have the Act available on site, the Act put up as posters in your workplace. Then it also deals with negotiations and consultations before the designation of health and safety regs. In other words, before your procedures are laid down, these must be discussed at a forum and an agreement put into place with senior managers and registered members of trade unions, so that these are discussed, everyone is in agreement with the process that's in place and that the process is fair and transparent. Moving on to recording of incidents and occupational diseases. A WCL1 form must be used for reporting an occupational disease and a WCL2 form for reporting an occupational accident. Section 24 deals with this as well, and the general administrative regulations of the OSH Act. Recording and investigation of incidents. I did touch on this earlier, that incidents must be recorded. There must be a process in place where they are recorded, and every incident must be fully investigated. And what's the reason for this? You want to make sure that the incident doesn't go by unnoticed and unattended to. In other words, you want to make sure that you find the root cause of the incident, put in place corrective and preventive measures so that you reduce the likelihood of that incident occurring in the future. This is just a screenshot of the COIDA Act, Compensation for Occupational Injuries and Diseases. Moving on to another regulation called the Facilities Regulation. This regulation deals with issues such as sanitation in the workplace, adequate toilet facilities in good condition, facilities for safekeeping, lockers and locked cupboards, etc. Change rooms for employees that need to change from their personal clothing into their work clothing, and then dining rooms for each employee, especially where hazardous biological and hazardous chemical substances are processed. These must be separate. There must be separate dining rooms from these areas to ensure that there is no contamination. Also, prohibition signs in terms of hazardous areas, no eating, drinking, applying of cosmetics, cell phones, etc. Whatever applies to that area, you must have the appropriate signage. Drinking water, there must be an adequate supply of clean drinking water for all staff. Seats, ergonomically sound seats with backrests, and condition of rooms and facilities. This is also required that every workplace must be maintained in a clean, hygienic, safe, whole, and leak-free condition. So when you're doing your internal inspections, when you're doing external or internal audits, these will look at conditions of rooms and facilities, and then the non-conformances need to be attended to. And in this way, you'll prevent getting contravention notices when the Department of Labor inspectors come in. Moving on to regulations for hazardous biological agents. What is an HBA? It is a microorganism, including those that have been genetically modified, pathogens, cells, cell cultures. So basically, it's your viruses, your bacteria, your fungi, your what else? Parasites, etc. So if everyone's aware of COVID-19, TB, hepatitis B, hepatitis A, these are all HBAs. Certain workplaces like hospitals, clinics, laboratories such as NHLS, their biggest, I wouldn't say their biggest, danger or hazard in the workplace would be hazardous biological agents. However, other risks and hazards do apply as well. So these employees need to know what the hazardous biological agents regulation contains and what they need to do in order to make their workplace safe and healthy for their staff. Information and training is on top of the list. Ensure that all staff are trained. They must be trained on the risks. They must be trained on the safety procedures, what precautions they need to be taken, and what procedures they need to be taken in case of exposure. For example, needle stick injury. Most of you may be familiar or heard about this. This is when an infected needle can accidentally poke into the skin of a nurse or a doctor. And here it's an injury on duty, and there must be policies and procedures of how this is dealt with. Moving on to duties of persons who might be exposed. So they have duties. Once they are trained, they must carry out the duties that they were assigned with. They must wear their PPE. They must report for medical examinations. They must report if they have been accidentally exposed or infected. Risk assessments, very critical, must be done every 2 years, and they are there to identify hazards in the workplace, evaluate the risk associated with each hazard, determine if that risk is high, medium, or low, and put in place effective control measures to reduce or take away the risk altogether. Monitoring exposure at the workplace, this will be based on the risk assessment. So if the risk assessment shows that if there is a potential for exposure of the staff, then there must be monitoring procedures in place. Medical surveillance, this also determined by the risk assessment. The risk assessment showing that there is a potential exposure, then medical surveillance procedures must be in place where staff health and safety is monitored, tests are taken, samples are taken to test whether they are still healthy, have they been exposed, etc. Records, all records, test results, risk assessments, medical surveillance records, health evaluation forms, etc. All of these must be kept for a minimum of 40 years. in compliance with the HPA regulations. Why? Because I may be exposed today, but the outcome may only be seen or discovered many years later. Control of exposure, the employer also has the responsibility to put steps in place to control exposure to their staff. These are, as I showed you, the controls. You get engineering controls, you get administrative controls, you get PPE, you get training, all of these things. Or you get elimination or substitution. Can I work with a chemical that is not as hazardous? Can I work with something else that is safer? Things like that. Then you go to PPE. We've discussed that in length. Labeling, packaging, transport, and storage of hazardous biological agents. There must be procedures documented and in place of how these things must be stored so that there is no accidental exposure, there is no theft, release of biologicals into the public areas or the community. So very strict security measures are required. And then lastly, the disposal. That is, once you've used it and there are infectious agents that you are throwing out, you need to make sure that it's properly disposed. We cannot just take our bins and throw it in the general municipal waste area. They are specially removed and disposed of by service providers that are trained and compliant with the waste management regulations of the country. Lastly, and my last slide for today, is hazardous chemical substances regulation. A hazardous chemical substance is a toxic, harmful, and irritant or asphyxiant substance or mixture of such substance for which an OEL is prescribed. And yes, it's a substance for which there is an occupational exposure limit prescribed, or maybe there is no OEL prescribed, but it creates a hazard to the health of the staff. In terms of hazardous chemical substances regulation, very, very similar to HPA regulations. You are responsible and required to provide information and training, duties of persons who are exposed, what you need to do, how you need to follow procedures, protocols, instructions, assessment of a potential exposure, air monitoring, like in terms of chemicals used in high quantities or needs to be measured in the workplace to ensure that they are below the OEL and staff are safe, medical surveillance if required, records. All records must be kept for 30 years. It is your risk assessments, your biological tests results, your air monitoring readings, all of these must be kept for 30 years. Control of exposure to hazardous chemical substances. What steps must be taken by the employer? Again, here we're referring to the controls, engineering controls, administrative controls, and then lastly, it would be your PPE. In terms of engineering controls, it will be things like HEPA filters, high efficiency particulate air filters. Things like biological safety cabinets in labs, fume hoods in labs, where it will protect the user from the agent that they are handling. Moving on to labeling, packaging, transport, and storage. The employer, the organization needs to comply with the country's regulations with regards to transporting and storing chemicals. And lastly, again, the disposal of hazardous chemical substances cannot be thrown with the general waste. It needs to be specifically removed and safely disposed of by a service provider that complies with the waste management regulations of the country. Thank you for your time. Please, as Ashraf mentioned, please consult the zero-rated NIOH website for a wealth of information on COVID and OSH occupational health and safety. And thank you. If there are any questions, you're welcome to note them, and I will assist in responding. Thank you for your time and attention.
Thank you very much. That was Michelle Morgan, the Deputy Manager in the National SHE Department of the NIH, servicing the NHLS employees together with her colleagues in the department there. Our next presenter is Karen Dupree from the Occupational Hygiene section, and she will be dealing with the topic, what employers, what employers need to implement in the response to COVID-19. And whilst Karen is sharing her presentation slides, by way of introduction, if I can just get through this, there we go, layers of open documents and apps here. By way of introduction, Karen Dupree is employed as an occupational hygienist and technical signatory at the Occupational Hygiene section of the NIH since 2017. She has obtained a BSc Physiology at the NWU in 1994, a certificate in occupational hygiene at the TUT in 2006, and an intermediate certificate in mine environmental control in 2012. She has worked as an occupational hygiene approved inspection authority from 2004 to 2016, gaining extensive experience in the implementation and the maintenance of occupational hygiene programs at various industries and open cast mine operations. And Karen is a registered member of SIO, that's the South African Institute for Occupational Hygiene, as an occupational hygienist since 2009, and is currently serving as chairperson of SIO's Professional Certification Committee, that is the PCC. I immediately hand you over to Karen Dupree. Karen, thank you very much for coming to share your wealth of information with us and our attendees today. I hand over to you.
Thank you very much, Ashraf, for that introduction. Michelle has set the stage for us for, in general, what is, or under any circumstances, what is the responsibilities of employers under the OSH Act at any workplace. So what we will take from here forward now is specifically now in response to COVID-19, what must employers do? So there's such a lot of things, and at some stage I think all of us were so overwhelmed. We're getting the hang of it, we're getting the hang of processing a lot of information in short periods of time. But just as a summary, so there's such a lot of information, I'll just really try to summarize and give some specific points of what then must the employer now do still in this day and age. I think a year ago, no one of us would have thought that we will still be in this situation. So much of what I will say will not be new information, but just to emphasize and just to summarize, as I said again. So what we gathered now from the previous presentation as well is that any employer has got duties and must implement preventive measure at the workplace to make sure that the workplace is safe and healthy for the workers. The references to that, or where we get that information from, would be from the OSH Act itself, as Michelle has very wonderfully described for us. And then also the most current issue of the directions that was issued by the Department of Employment and Labour. So the current version of that is the one that was issued on the 1st of October 2020. And this will be applicable for the duration of the national state of disaster, unless it is otherwise then indicated or superseded by another document. There can also be other sector-specific regulations or directives that can be issued in terms of the regulations under the Disaster Management Act. But all of them must then include the aspects that are listed in Annex B of the Consolidated Health and Safety Directions. And also, as Dr. Chin has mentioned, there's a lot of wonderful resources available it's very good. I think one of the most important duties of an employer within the current situation is to make sure that they stay ahead of, that they stay on top of all the new information that is published. I just gave one of the references there, but Dr. Chin has shared with you more. So what is our current status at the moment? At the moment, we're at alert level 1 lockdown, and in the regulations that was most recently published, what that means with regard to workplaces is that all persons who are able to work from home must still do so. So that is published in the regulation like that. I know there's an absolute cry out from all of us to go back to what we've known as normal up to now. So it's very difficult, but it's still, all of us must still, must not become complacent, and where possible, must still adhere, or must still make sure that we really do whatever we can to make sure that a third wave or any further infections are limited as much as possible. So according to the regulations, table 4 of the alert level 1 regulations, it still states that all persons who are able to work from home must preferably be still do so. Persons will be permitted to perform any type of work outside the home, so there's no restrictions on that anymore, but it is subject to strict compliance with the health protocols. And then if a workplace bring back employees to work, that it must be phased in, that the workplace must be COVID-19 ready, that return to work must be done in a manner that avoid and reduce risk of infection, and that the work that is still listed in the table in this regulations are still then prohibited. There is still some economic exclusions, like attending sport events and going to nightclubs and things like that. So those employees can still not go back to work. The consolidated directions, just to remind you what it looked like, because this was published already in October, so all of us must make sure we've got this handy next to us the whole time. And what I just want to emphasize here is the amount of information that's available in this specific document. So on the annexures, you've got a lot of links to websites under Annexure A. You've got Annexure B that give you the sectoral guidelines of the information, as I mentioned, that must be included in any sectoral guideline. And it also gives you the list of contact details for provincial inspectorates. That is also referred to in the document.
But there are people that are answering, yes.
Sorry, Ashraf, can I continue?
Please do. It appears that one of our colleagues' microphone may have gone on inadvertently, not knowing that it's on the session. Apologies for that, Karen. Please proceed.
No problem there. Sorry for the interruption then. So over and above the annexures and the information there, also please take note on each of the pages. If they refer to any document or anything that must be done, there will be footnotes on the pages. So with that document, there's really a lot of information, a lot of references and websites that also provide, or documents specifically that it referred to, that you can access to get all the relevant information that you will need. So Michelle emphasized the importance of the risk assessment in any workplace. Also, any risk assessment must be reviewed if the current assessment is no longer valid, if the control measures are no longer effective, if there's any advances that can allow for more effective control methods, or if there's been a change in the work method or type of work or the equipment used. Also, if there was incidents occurring of occupational diseases, or if there's additional hazards introduced or identified. That means any existing risk assessment need to be updated and reviewed to include the risk to COVID-19. Specifically looking at the risk assessment for COVID-19 then, so how do we go about, what do we do there? It's extremely important to identify the work tasks or the areas where transmission can occur. So that's basically everywhere, but it's important not to look at it as a whole, but to really look at each and every workplace on its own, work task on its own, and even employees doing different tasks in a different manner or under different circumstances, to really look at that individually. It's very important to identify the vulnerable workers, and there is a guidance on that. Also, as I said, referenced in the footnotes and in the annexes to the document. And suitable control measures need to be identified then, to include the need for PPE for each task individually, to really, as I said, not to assess the workplace as just one unit, but really looking at each and every work task and work area in that organization and treat it separately then. Must consider any additional hazards that can be introduced in response to COVID-19. So that's also the chemicals that you're going to use for disinfection, or anything additionally that can be added or due to the pandemic and the situations need to be addressed in the risk assessment as well. And this risk assessment need to be reviewed if there's any changes to the work processes, or if there was a confirmed case at the workplace. We'll talk about that a bit later again. So in the directions, the first thing that it says is the moment that a business can commence. I know most businesses maybe did, but there are some exclusions. So the moment that at that point that the business commences with business, the employer must develop a plan to say exactly what are they going to do, and to make sure that employees come back to the workplace in a phased manner, and it must be based on the risk assessment. Michelle mentioned that the risk assessment is the foundation of health and safety in the workplace. Still, with the COVID-19 situation, that remains the truth. The employer must consult with the trade union, if applicable, at the workplace, and then the health and safety committee, or if there's no committee, then the health and safety representative. So this must be done as a team effort. What we've really seen since last year, and I think many people will agree with me on that, if you've got a workplace where there's transparency, where employees don't get the idea that employers are hiding facts from them, then it's very easy to get the cooperation of everybody. So as far as possible, to handle everything that is implemented, especially in a circumstance like this with COVID-19, where there was initially, and I think still is, many uncertainties. I mean, none of us know exactly when this will end, how this will play out. So there's a lot of uncertainties still remaining at this present moment. So it's extremely important that it can be dealt with from management side in a very transparent manner, because the moment you do that and employees don't get the feeling that you're hiding things from them, it means that they feel that their health and safety are really important, and that they are not only pawns working in the organization, but they can also contribute and raise their concerns, and it will be dealt with and it will be considered. So it's extremely important that the cooperation between the role players are really strengthened and encouraged. The plan must be available for inspection by any inspector from the department, and also the persons listed above. And so the plan must be implemented, but it must really, the actions must then follow what was included in the plans. It's very important to actually then follow the plan that was developed. The plan must include the date of reopening plus the business hours, must list the employees that are permitted to return and those that will still be working from home. There must be a plan and timetable for the phased-in return. Vulnerable employees need to be identified. Also the measures on how to minimize the number of workers at the workplace at a specific time. The workplace protective measures, measures for daily screening, the details of the appointed COVID-19 compliance officer, we will talk about that, and then also procedures to resolve issues in the case of refusal to work, as is described in Direction 14.1. We'll also talk about that. So all of this is the details that must be included in the plan that must be developed. So this direction, over and above, very important, as I said, so this directions is applicable for as long as the national state of disaster is ongoing. It doesn't replace the requirements of the OSH Act. This is additional to, so it's very important to know that and to really to understand that this doesn't replace what usually must be in place, as Michelle described to us. This is absolutely additional to that, and it fits in with the requirements of the OSH Act. So it's just to emphasize those measures then that must be addressed additionally because of COVID-19. So it's divided in specific classes of measures that the employer must consider. And under administrative measures, the moment there are more than 50 employees, there must be a record of the risk assessment and the health and safety policy under Section 7.1, but also that specifically talks to COVID-19, must be submitted to the Health and Safety Committee and then to the Department of Employment and Labour. And the specific requirements for that submission is then in the footnote on that directions to tell you exactly who to send it to, how to do it, how to go about. And then within 21 days of commencement of the direction, so it's applicable. Special measures must be implemented for vulnerable employees. Employees must be provided with information and training on the applicable legislation and the regulations, all the hazards that's involved. So it means information on the virus and COVID-19 itself, the manner of transmission, measures to prevent it, what to do, how to go about for screening and testing when applicable. And this information can also be done through or complemented with leaflets or notices where possible. We also know that the more visual information is, if you can distribute information in a visual manner, you know, it draw attention and people are constantly reminded of that. Employees should take sick leave and stay at home when they are sick or displaying symptoms that can be associated with COVID-19. We talked about the COVID-19 compliance officer. So this must be a person, preferably not a junior person in the organization, because there's duties and responsibilities that must be implemented by this person. Because this compliance officer must oversee the implementation of this plan that was developed by the employer, must oversee adherence to the health and safety measures, and must address concerns and ensure that employees are kept informed. So typically this must be a person that employees will be comfortable with ensuring if they've got any concerns, and this person must then be able to be part of management or communicate to management through meetings to make sure that these that each and every employee's concerns can be addressed in this with regard to COVID-19. the employer must ensure compliance to all the regulations, or all the requirements through monitoring and supervision. The number of employees in a workplace must be minimized as far as possible through maybe shift regimes, rotation, remote working arrangements, and contact between employees must still be minimized, and between employees and the public. So still then, if a person now is diagnosed with COVID-19 at the workplace, there are certain duties that the employer have, and firstly must inform these. There's certain departments or places that need to be informed. All of that information is on the footnotes as well. Then you must investigate. How did this happen? Was there maybe control failure? The risk assessment need to be reviewed. Maybe there was something that changed. A certain way that work is done could have changed, or certain control measures is maybe not applicable anymore or not effective anymore. And then you need to ensure that the necessary control measures, including PPE requirements, are in place and adhered to. Further, the employer must then determine the need for temporary closure to decontaminate the work area where that specific person worked. Very important again, transparency. It must be in consultation with the Health and Safety Committee or their representative. It can be based on an incident-based risk assessment and to follow the Department of Health guidelines. And then the employer must also provide administrative support to contact tracing measures where applicable. So this is specifically if there's a person diagnosed with COVID-19 in the workplace, make sure, and all of this will be based on the risk at that moment. Was there high risk exposure or more low risk exposure due to that person? So all of that need to be considered. So it's a case-by-case situation. There's still under the administrative measures, the duties of the employer is to submit the data that is required as per the timelines specified in the directions, and to inform employees of the submission of the data. Another class of measures that need to be implemented in is the social distancing measures. I think we are so familiar with all of that, but it's so important that we don't get complacent and really be reminded of this again. Workplaces need to be arranged to maintain at least 1.5 meters between workers. The workplace circumstances. So again, it's a case-by-case situation. Whatever is applicable for that specific workstation or workplace need to be considered, and as best possible, this need to be implemented to make sure that employees can remain or can do their work and still maintain the social distancing as applicable. And this is also at the work area and also the common areas such as the canteens and hygiene facilities. With regard to symptom screening, so that still need to be done on a day-to-day basis for the employees at work as well as people entering the work area. There is the Department of Health will issue guidelines, or the guidelines are issued, but if there's updates to that, the employee need to stay just on top of that and know what is the current symptoms to look out for and to consider. And there's also specific requirements if a worker presents with or reports symptoms. They are not permitted to enter the workplace, and if they are already at the work area, they need to be isolated. The risk of transmission need to be assessed. Those employees need to be put as per that, the specific direction need to be put on paid sick leave. In terms of the BCEA, steps need to be taken to ensure that there's no discrimination against this employee. and then where applicable, a claim for compensation then need to be lodged. Also the requirements when to allow a worker to return to work, and how to go about with workers that's been in contact with a person that's been diagnosed at work, or to a worker that's been diagnosed with COVID-19. As I mentioned, you will then look at whether it's a low-risk exposure or a high-risk exposure, and those definitions are also included in the guidelines. And then the specific requirements for quarantine that's required. With regard to the sanitizers, disinfectants, and other measures, nothing has changed there. The need, or the employer need to supply hand sanitizer to employees at their workplace, also at the entrances to the building. And if someone is not working at the office, at the specific office area, and maybe traveling to clients or workplaces or so, that employee need to be supplied with adequate supply. This does not apply to working from home. That's if someone go from an office to different sites or whatever the case may be. If there's interaction with the public, the employee must have access to sanitizers at his specific workstation, and there's a requirement to sanitize hands between each interaction. Surfaces need to be disinfected before, regularly, during, and after work. Also, depending on the interaction, whether it's with these employees and the public sharing areas or surfaces. So wherever the risk is, the employer must implement whatever is necessary to maintain the health and safety of the employees and everybody in that workplace. Biometric systems preferably not be used, or there must be measures to ensure that they are safe. And then hand wash facilities, very important, with paper towels that need to be available. And employees must be reminded to make use of it often. The requirement to wear cloth masks still remain. So whenever we are in a public place, we need to wear at least a cloth mask. Employers initially, I think at most workplaces, employers did provide their employees with at least 2 cloth masks. That's a requirement still as specified in the directions. And any other person in that workplace need to wear a mask when they are in the workplace. There can be sectoral guidelines, and again, the specific work situation will dictate how often masks need to be replaced, or all of the further details on that. But it's extremely important. I keep emphasizing that this is implemented over and above, or together with, the already existing requirements of the OSH Act. So if there is in your workplace a requirement to wear specific respiratory protective equipment or any other PPE, it still remains, and you cannot replace the specific RPE that you were required to work in your workplace now with a cloth mask. So whatever was identified through the risk assessment as the applicable PPE for your specific work task, that still remains. You will go to your workplace. While you travel to work, you will wear a cloth mask. If you, amongst other people, you will enter the workplace with your cloth mask. You will then put on the required respiratory protective equipment for that specific task that you perform. While you do the task, you wear that RPE. When going on breaks or leaving in the afternoon, you will remove your RPE and put on your cloth mask again and go further. So it's really not replacing any existing PPE that is required as per the risk assessment. So any workplaces where the public have access, the employer must determine the floor area to make sure that there's not more people inside as the area can allow, to still make sure that they can maintain the social distancing as required. Physical barriers need to be implemented at counters. Symptom screening is important. Daily notices need to be displayed. Everybody must wear masks, the distancing, there must be sanitizing of hands at the entrance before people enter the premises, and there must be an employee that's assigned as compliance officer to ensure that all of these measures are complied to. With regard to ventilation, then still every workplace must be well ventilated. I know we're moving closer to winter again, so it will be difficult for most of us again, but where possible, to open windows in your workplace is very effective and very easy to comply with measure that you can do to make sure that there's good ventilation in that workplace. If there is local extraction ventilation with HEPA filters, it needs to be technically assessed to be functioning effectively. It must not recirculate air, must be cleaned and maintained, and the vents must not feed back through open windows. And the cleaning and the replacement of filters need to be done by a competent person as per the manufacturer's instructions. Specific PPE required specifically for COVID-19. Refer to the information that is available. It will be task specific or workplace specific, depending on what is the nature of the worker's duties and the associated level of the risk, and that can include anything from surgical masks to N95 respirators, face shields, aprons, whatever is applicable to that specific workplace as was identified through the risk assessment. For any workplace with less than 10 employees, there's still the same measures that need to be implemented. People need to wear masks, need to comply with social distancing. If anyone displays symptoms, the measures must be taken, that's specified. Hand sanitizer must still be provided to all of the employees there. And then any additional measures that's indicated by a risk assessment for that specific workplace need to be implemented. So I think it's the message here is also really all of these measures are definitely workplace specific and task specific and need to be considered in that manner. The work obligations, Michelle emphasized Section 14 of the OSH Act that provides the general duties of employees at work. The same still applies. So all of these additional measures will also fall in there, and the employee need to comply with all of these measures that the employer implement for them to remain safe and healthy. The employee have a duty to refuse work if they can provide evidence, or if they really can, if they have a real concern about a work task that it can have pose a substantial risk for exposure to COVID-19, they have a right to refuse work. It's not, you really cannot use this if you don't feel like working. You must be able to motivate why you say that, and to bring evidence of why you say this. And then the employee or the health and safety rep must immediately notify the employer if such a situation arises. The employer cannot just ignore it. He must consult with the compliance officer, the health and safety committee, or the health and safety rep, whatever is applicable at that specific workplace, and must undertake to resolve the issues that led to the refusal. If it's something really, if it's really something like there's no sanitizer available and the employer did not replace sanitizer at the workplace, it's really your responsibility to raise these issues and to make sure that all of these issues or all of the measures are really implemented as it should, and that every workplace need to remain safe. I think it's something that we always say when it comes to health and safety, it's not an individual thing. We must always look out for each other, and here it also applies. We must really, if anyone identifies a situation that can be hazardous, it must be made, it must be reported, and it must be addressed. And any employee that does raise a concern or does refuse work cannot be threatened or dismissed or subjected to disciplinary action. If anything happened in that, or if an employee refused to work, they act within their rights as per this directive. So they have legal backing in this matter to say this is why I refuse to work and this is my reasons for doing so. So in short, that's just quickly running through that directive. Please, as I said, please keep it handy and please go read through it. If there's any specific questions, all the information is there, and there's a lot of references and information and links to websites that can be followed and can be accessed there. Thank you very much, Ashraf.
Thank you very much. That was Karen Dupree from the Occupational Hygiene section of the NIH, dealing with what employers need to implement in response to COVID-19. Our next, just a reminder to colleagues, please, the raise hand function is not active for this webinar. We've got too many attendees to allow for you to be able to speak using your audio. Type your general comments in the chat box and type your questions for the presenters in the Q&A box. Our next presenter, as indicated earlier, is Dr. Jan Lapierre, who is an occupational medicine doctor, an independent occupational safety consultant with a specialization in social labor law. So some of those questions he's been answering already in the Q&A box for you that relates to those areas. And Dr. Lapierre will be dealing with the employer COVID-19 containment in practice. And whilst he's checking his audio and sharing of slides, I just hope I can find that notes I've made with regard to Dr. Lapierre's bio, because otherwise I'm going to ask him to just briefly add something as per introduction with regard to this unique combination he has of occupational medicine as well as social and labor law. So Dr. Lapierre, I'm handing over to you. The reminder to our other presenters just to focus on the questions in the Q&A box. After each of your presentations, there would be questions people had asked during your presentation. So if I could ask Karen just to also spend some time there together with Dr. Graham Chin and Michelle Morgan to look at the questions that have not yet been answered. All presentations links will be circulated to you as soon as the webinar is done and the links have been created. And also as a quick reminder, once our webinar is done, we're going to send you a red cap link for you to give a feedback and an evaluation of this webinar, and where you can add any new topics that you would like the NIH's COVID-19 webinar series to cover. I see that Dr. Lapierre's slides is all ready for us. I'm going to hand over to him immediately. We are going to use some of our question and answer session time in order to allow Dr. Lapierre to complete his presentation. We are running slightly behind time. I hand over to you, Doc.
Thank you, Ashraf. If you can't hear me, just interrupt me. If you hear me, let's continue. I think by way of introduction, it's just a confusing way to wake up every morning and decide whether you're going to see yourself as a doctor or whether you're going to fix yourself as a lawyer. So that's about the combination that we're going to go through. I'm going to take a little bit of a different tack as the previous speakers. Essentially, what you by now should know is that we've got a labor legislation that's applicable to the COVID-19 epidemic management by employers, and that a whole lot of duties emanate from that. Graham Chin's questions, when is the third wave, and his answer to it is stay ahead, makes this presentation a little bit awkward in time, because we see a reduced positivity rate, we see a reduced number of cases coming up, And so it looks as if, you know, what we all being asked to do, what we're being forced to do, we are all held in the hands of those people that we trust the least, i.e. politicians, and we have to live with all that. And then things are going fine here. I must tell you, I think it's going fine because we're doing what we are doing. If you look at Europe, if you look at Latin America, it's not going fine there. I don't know why that is. And I just hope that I'm wrong and that we could have gotten away with not doing this. But at this stage, what we're discussing here are not nice to haves, they are musts. And for that reason, my second slide actually talks about something that maybe is not publicly spoken about so much. It's the good, the bad, and the ugly. So I always juxtaposition the rules with the practices. And then right at the end, what I've done is, just like Dr. Graham Chin has done for us going through the calendar, I did the same thing for law. I went through all the different laws that came about and identified what rules were put out to employers and employees in the workplace and listed them, then wiped them out as they disappeared, you know, as Minister Zuma takes it and brings it and takes it back again, and as the Department of Labor and as the Department of Mineral Resources and Energy does it. And eventually I came up with a final document, which are the final slides, but I've also got a Word document, which I sent to Ashraf, in which all the current rules are listed in an audit, in a self-audit session. So if Ashraf is willing to make this available to you, you're free to use it. You can actually check where you stand in your organization. This thing all starts with something that I see none of the speakers have spoken about, but SARS-CoV-2 was declared a Category 1 notifiable disease, and that triggers off, besides the disaster management regulation, that triggers off a whole lot of rules under the National Health Act, and there's a specific regulation relating to notifiable conditions. So most of us in the medical field fall within a strict set of rules, and most of us as citizens also fall within a strict set of rules, essentially, which can compel you to be tested, which can compel you to take treatment if there were, which can compel you to isolate if you're sick and to quarantine if you've been exposed and you may be incubating. So besides all the politicians adding the things for SARS-CoV-2, just that one single declaration where through the NIOH, SARS-CoV-2 is a Category 1 notifiable disease, imposes a lot of rules on citizens. And this is obviously a social part of law, which stands as it stands today. Afterwards, additionally, the Disaster Management Act came out with a whole lot of regulations that apply to us. And then one of them was that it allows ministers like the Department of Labor, like Mineral Resources, like RSR, to issue new laws also. And, you know, the most pertinent one for us are the two labor laws and the Compensation Act. And then the NIOH and the Department of Health issued a lot of directives, and most of those directives, as they apply to the workplace, are incorporated. So the legal burden on the standards is actually quite high. So if you look at what we're dealing with besides that, this is what we've discussed here today, is labor law. We've got our common law duties of employees and employees. We've got the contract of employment, which may impose additional duties. We've got the two labor statutes, occupational health and safety, mine health and safety. Then Basic Conditions of Employment Act. I've been trying to answer your questions in the question and answer box on sick pay, but that may be just a chat on its own once again. Similarly, for employment conditions, on vulnerable employees, on ill health and working capacity, and on, unfortunately, the retrenchment as businesses have closed down. It's not a health issue, it's just a business issue, but it's come up in the COVID pandemic. Employment equity goes on medical testing, and I should add to this thing now, maybe the vaccination. I will shortly go into that. Employment Insurance Act, you've seen the TERS that has come up, so it's been a massive support for employees. And then, of course, the work-acquired COVID-19 as an occupational disease in the rights of occupational diseases. So what is it in the workplace that we want to, that we don't want to see really? We don't want to see COVID-19 introduced in the workplace through a sick employee. He mustn't come to work when he's sick, or he mustn't be at work and be contagious at the workplace. And then we don't want people to come to work and catch COVID-19 as part of their work. So the contagion, the infectiousness is the employee that's sick. It's the customer at the supermarket that gets sick from the cashier. The first one is the cashier getting sick from the customer. And then the last one, of course, is this epidemic is an epidemic probably mostly for those that are going to die, and not for the 80-odd% that are just going to get a minor illness. So just having contracted COVID-19 one way or another, you may just take it to your grandfather or to your mother-in-law. Your COVID containment at work, I think we've had long talks about this now. I think Karen and Michelle have really gone into great detail as to what's all required. Remembering that most of the things that Michelle has listed are there already. We just got one single agent added, which is the hazard biological agent of COVID-19. So a lot of those requirements should have been in place already. But the employer must provide a healthy workplace for employees and for all other people affected by the work. There must be risk-based COVID-19 containment. I think, you know, I don't have to tell this anymore. This has been emphasized. The employers must deploy the necessary resources. And what are the necessary resources? It's statutory compliance with the disaster management regulations and with the direction and guidelines of the two different departments. An employee has got under Section 14 of the Occupational Health and Safety Act and 22 of the Mine Health and Safety Act has got 5 duties. Every employee is responsible for her own health at work. Every employee is responsible for the health and safety of employees affected by their work. Employees must follow the lawful policies and rules and procedures of the employer. They must immediately report ill health or any other safety abnormality in the workplace as a non-conformity. So there are the 2 duties next to each other. I've tried to make a big 4. I couldn't find a big 5, but there are big 4 containment controls. What you really want to achieve in your workplace is this. 1, you don't want a contagious person to come in the workplace, to enter the workplace and bring this thing to work. Number 2, your main thing at work is you want to avoid the airborne and the droplet and the infectiousness that comes from closeness or from sharing the same breathing space. Number 3, you don't want fomite contagion. Fomites are infected articles like the handles, or it is under discussion whether you can get COVID-19 from touching a handle. Certainly from a biological risk-based deduction, it is one part of the infection. So let's live with it at this stage. At worst, we're just evaporating a hell of a lot of alcohol and bleach. And then the 4th one is evacuate a sick employee in the workplace immediately. So those are the 4 things that we have as objectives to start with. Now, if you just go back there, the contagious person in the workplace, that's number 1, is we don't want a contagious person in the workplace. We don't want a sick employee in the workplace. What does the Department of Labor say? The Department of Labor says you must screen when reporting to work and not allow a COVID-19 person to enter the workplace. And the screening has got this long list of symptoms given out by the NIOH, by the Department of Health through the NIOH, and that's those. Do you cough? Do you have a sore throat? Do you have shortness of breath? I'm not really going to go through them all again, but there they are. There's no explicit duty to take temperature. If you don't take temperature, it's also fine. The DMR guideline is much, much older, and it hasn't been updated. It requires a screening at the start of every shift. It doesn't detail what the screening is, but on the mines, it requires to take the temperature. Just to give you a notion on, if you go to the NIOH and you read the latest on COVID-19, they update their documents punctually there, and you look at the management of COVID-19, you will see it's updated in March. and it still confirms, whilst temperature is the most frequent symptom, it is hardly ever present when persons get sick in the beginning. And in fact, when people are being seen by doctors or being admitted to hospital, temperature is not often present. So it's not really a good way of dealing with the matter, but it certainly is totally incomplete in terms of the Department of Labor requirements. So the gist of the law is that a sick employee does not come to work, and an employer does not allow a person under investigation, or the latest one is a suspect case, to enter the workplace. A suspect case, you got the symptoms listed on top there. So what is the compliance? One, the employee must report if not well. He must report. He's got no option but to report. It's a duty. Number two, the employer must symptom screen prior to entry in the workplace. And number three, the employer must not permit the worker to enter if positive screening. On the right in the red is my personal experience, and I may be wrong at your organization, but the majority of the organization that I consult for, that I visit, that I go to, have got serious problems. There are obviously there are large organizations that stick to the rules, but certainly the smaller the organization is, the more you see that there is no screening done anymore. You just walk in and out there as if nothing's happened. Or the screening is done after entry. I've seen this where everybody goes to the manager and the manager does a screening. By then they've passed by everybody at the plant. Or the screening is done incompletely. They're not asking all the questions out there. Or in a lot of instances, a temperature is taken, and if your temperature is anywhere between 32 something, where you should be dying of hypothermia, to 37, you can enter the workplace. Nobody asks anything. The screening is not done by a competent person. In many instances, it's done by security officers. Now, security officers can be competent, but you can only be competent if you're trained and you are checked that you've got the competence. And that's often not the case. And then the last one is, particularly for management, they screen and they enter anyway. I've just got a cold, don't worry. I'm just quickly going to go to work, and then later I'm going to go to the doctor. And the person at the gate hasn't got the authority, or doesn't feel that she has the authority to stop the work from coming. So this is the juxtaposition of what should be in place and what I see is happening out there. The second one is the contagious employee. Now that's something totally different. That's the guy that at work, he passed the screening somehow, but he shouldn't be at work. And so is that possible? Well, both the Department of Labor and the Department of Mineral Resources and Energy guidelines say that it's not possible. You cannot be outside your house in terms of the Department of Health, and you cannot be at your workplace in terms of the labor laws when you are possibly contagious. And here I go back to those regulations. Now, what the regulations on these notifiable conditions says, it says that a healthcare provider must notify a focal person of the Department of Health of any diagnosed COVID-19 case. He must ensure adherence to the regulations. Now, the regulations include the notion of a person under investigation, a suspect case, a testing case, a quarantine between clinical assessment and testing, an isolation if you're positive, a quarantine if you're a close contact. That's all that. And they must adhere to the DOH guidelines on the surveillance and control of notifiable medical conditions. So doctors must make sure that people don't come to work when they should not be at work. Here I've got on the contagious employee, this is the current website of NIOH. What is a suspected case? It's any person presenting with an acute respiratory tract infection of less than 14 days, or any other clinical illness compatible with the C19 symptoms that we saw just now. It's an asymptomatic person who is a close contact. Close contact is more than 15 minutes within 1 meter of a confirmed case. And then there are key respiratory syndromes, which consist of any of those below. and also an acute worsening of somebody with a chronic lung condition, somebody with an acute asthma, somebody with a worsening of emphysema or chronic bronchitis. And a close contact includes all persons living in the same household. So you may just feel where I'm going to. So what's compliance? The compliance is that every employee reports her own health. If I'm not feeling well, I must report this whilst at work or before I enter work, and also reports what's happening in their houses or in their chommies or in their church or wherever there was a close contact outside work. Then there's case management by medical practitioners. So if a medical practitioner sees somebody with an acute respiratory tract infection, that doctor cannot write on that sick certificate, the man is off for 3 days because of upper respiratory tract infection, and not do a COVID test. And then obviously people returning to work after they've been so-called seen by doctors who booked them off on a sick certificate from day 1 to day 4. And employers consider that the doctor on day 1, when you booked that patient off, was sure that on day 5, that employee could return to work. No doctor's got a crystal ball. So the return to work assessment is an important compliance assessment by the employer. So what do we see is we see non-reporting of own symptoms. That is very common now. To enter a workplace, somebody is blowing their noses and I've just got a cold, don't worry, it's not COVID. There is no such thing as not COVID unless you've proven that it's not COVID. The other one is the not reporting of a family illness. No, my child's got a cold, and children don't get COVID. That's the common thing to say. I must remind you that in Europe currently, 2 drivers of the third wave that have been identified are, one, us, employment. That employment is a big driver for the current epidemic in Europe. And secondly, something we haven't seen here at all is schools and school-going children are also one. So the non-reporting of a family condition can really trigger off our low levels of 800 and 1,000 new cases a day. We can just be popping in the 8,000-9,000 cases if we're not following this. And then last one is here for the doctors. I can't see many doctors listening, and I wish they were listening, because I and my colleagues around me have had many unprofessional fights with our colleagues that say, but this person has had a cold 3 times and you've made me do a COVID test 3 times. And say, well, that is the law. Don't write on a sick certificate upper respiratory tract infection, but it's not COVID. This is what's written, flu, but not COVID. Unless a COVID test was done, an employee with an acute respiratory tract infection is a person under investigation and must be going for testing, or if he refuses to go for testing, he must be going into the prescribed 10 days quarantine. So that was the first one. Remember, the no contagious person in the workplace, that was rule 1. Rule 2 was no droplet or airborne contagion in the workplace. Just now, Karen went through all the details of this. It's quite an extensive list. Minimize the numbers at the workplace, minimize the contacts between workers and workers and workers and public and workers, determine floor areas and number of persons that can be in those floor areas, keep a distance of 1.5 meters between workers and public, members of the public. If you are dealing with members of the public, you are liable for that distance. Physical barriers at counters prior to the provision of face shields. Ventilation of workplaces, cloth masks at all times. There was a query there, cloth masks are a law and they must be there at all times. And then very important, a compliance officer to make sure that all these measures are complied with. When there's traffic cops on the road, we stick to the speed. When we know there are no traffic cops on the road, we might not stick to the speed. So what do we want to see in terms of compliance? We want to see no bunching at the workplace. We want to see that social distance is kept at 1.5 meters. We want 6 air changes per hour in every room where people are. The minimum in the law is 2 air exchanges per hour, but you want 6 when people come in there. And that's in many instances not the case. And then we want a cloth mask, or if you have close contact workers, the combination of either FFP2 or N95 respirator together with a face shield as PPE. What do we see? We see bunching at the entry, bunching at the exit. You know, it looks like employees often only come into line once they enter the workplace. We see in the workplace, we see less than 1.5 meter work being uncontrolled. In other words, you can put a work permit system in place where people have to do close contact work, and you put the necessary measures in place. That is permissible. I mean, 2 electricians working together in the cage of a cherry picker, they are closer than 1 meter for a long time whilst they're working together, and that has to happen. So, but then it must be controlled. There must be controls put into place. Then no ventilation or less than 2 air exchanges per hour. Let me remind you that the normal air conditioner doesn't bring fresh air into a room. It basically cools down the room air by 1 degree with a cycle, and then by another degree with a cycle. And so it keeps sucking in that same air and blowing it back cooled down. Sometimes there may be a 1, 2, 3, or 5% fresh air in there, but there are very few air conditioners that will take Joburg's 30-degree air out and blow it in as 20 degree on the other side. That's not the way we work our air conditioners. So if you've got an office with an air conditioner, that is not air exchanges. That's not offering you air exchanges. Then we often see no wearing of masks. You know, we're working together, we don't need wearing of masks. Or we're sitting in an office, I'm not wearing my mask in my office. It may be all right if you're not wearing in your office, you're sitting all alone, but then you need a red line at the door, and people must know, you must stop by the red line, and both of you must put your mask on before you go into the office. That's the law, whether you like it or not. And then the last one is, oh, these clowns that are making money. 200 million rand for the Department of Education alone on fogging places. If you could fog SARS-CoV-2 out of the air, 1 whiff of that toxic air with that chemical that can do this would kill you immediately. So there's no such thing as fogging. And if you're still doing it, you're being done in by somebody that doesn't know what they're doing. Fortunately, our Department of Health through NIOH has got a document on that, which clearly states that this should not be done, and that if you're doing it, you're exposing your employees to an additional risk. The third one was the fomite contagion, the contagion of surfaces. So we have got hand and surface washing and sanitizing. So that's your own hands. Then it's work surfaces and equipment and facilities. Then there's a legal requirement on the biometric systems to be COVID-proof, so some form of system to clean before and after you use a biometric system. And then there's the supply of adequate facilities, as Karen went through there, soap, water, and paper towels. Compliance is hand wash practices and hand wash resources, and then a sanitized planning validated routine. Once again, here is there are a lot of cleaning companies in South Africa that claim themselves to be specialists in cleaning, and they even give out certificates. And once again, fortunate NIOH and Department of Health have issued documents to say there are no such certificates. They are invented certificates. You download them from Google. You know, when there's a cleaning routine, it must be validated in terms of the concentration, well, in terms of the chemical that you use, and their chlorine and bleach are all right, but there are other chlorine solutions that are acceptable. They're listed on a CDC note, and you can contact me if you want a CDC referral for that one. Then there's obviously the dilution in which you use it. There's how old the dilution is. There's the method of application. Invariably, spray doesn't cover the whole surface. So if you spray with a spray, you've got to wipe with a cloth. That's the rule. And then obviously, whatever you do has got to go through a process that everybody's trained to know what to clean. There's things that you don't need to clean. There's things that you need to clean more frequently. So if you're looking, what are we seeing is, I mean, if you look at people wearing a mask, they're forever fiddling with their mask. If there would be a germ trapped by your mask, it's going to be there where you touch it. So don't touch your mask. Don't handle your mask. Don't have this thing dangle on your rearview mirror in your car and then have your blower blow over it. That makes no sense. It makes sense if your mother-in-law sits in the back and you want to get rid of her, but that may not be the objective. I got a wonderful mother-in-law. I wouldn't do that. So masks, the handling of a mask is just not something that goes without the rules. And the rules are, prior to touching it, you wash your hands, and when you finish touching it, you wash your hands again. Facility sanitizing, when the permits came out to start opening new businesses and they were essential business, and then when the planning came out that all businesses could open, every toilet was sanitized, every toilet door, every handle, everybody entering the toilet was sanitized. That slowly seems to have come to an end. So, and that is still a place where people wash their hands and go to the toilet. That's still a place where if COVID had to re-enter our world here, God forbid, that, you know, it probably would be a concentration, a possible concentration. I said just now, spraying without sweeping doesn't help. The incorrect sanitizer, that's another one. You know, just make sure that you use the correct one. There's all kinds of people that have invented these massive inventions. And the simple stuff is that simple bleach works best. It just doesn't work on your hands. Don't spray the bleach on your workers' hands. Your workers' hands, when they're dirty, they must be washed with soap. When they are clean, they can be sanitized with alcohol. The whole method of cleaning for SARS-CoV-2, SARS-CoV-2 is a weak virus. It's enveloped in a fat layer. It's got like a layer of olive oil around it. And if we take that layer away, then it dies. So alcohol dissolves that layer and soap dissolves that layer. But if your hands are full of grease and there's some virus in there and you wipe them with alcohol, then what happens is the alcohol dissolves the grease but never gets to the virus. So that's the difference. Dirty hands are washed with soap. Clean hands can be sanitized with alcohol. And then last one, often these foggers are also deep clean contractors. And there is no such thing as deep cleaning. The virus doesn't live long enough for a weekend to have to be cleaned on a Monday. So yes, where you've had an infected person at work, you go and identify where could that person have coughed on, where could that person have breathed on, what could that person have touched, and you make a validated cleaning of that one, and that's the end of the story. Our last one is evacuate a C19 suspect ill employee at the work immediately. Well, already we had that workers with C19 are not permitted to enter the workplace, but when a person is ill, these are the rules that Karen went through. Is the person must identify herself immediately, must be taken to an isolated area where there's nobody else, given a surgical mask, must special transport where the driver knows that he's transporting a suspect person, and there's measures in place for this, to a health facility. That can be the person's own doctor, that can be the person's clinic, but it can't just be, you know, I'll take you home and you sort yourself out from there, unless you know that some arrangement is in place that person will end up as a health facility. It's an added employer liability to make sure that the COVID-19 positive symptomatic person in a workplace is taken to a health facility. Obviously, then you do that risk assessment, which I went through just now. What has happened here at workplace? Who could have all have been close contact? Who are casual contacts? Where are the fomites that need to be dealt with? You disinfect the fomites and do your contact tracing and referral of people that are close contacts or that are casual contacts. There are a whole set of rules for that. So what is compliance? Number one is that the employee must report it. Number two is compliance by all. What's good for the geese is good for the gander, but I often find that management can be having a cold at workplace, and then that cold is not really COVID-19. They've got like special colds for managers, or their children got special colds. So that's not on. You know, the compliance got to be there by everybody. Then the isolation evacuation resource must be in place, must be something planned. There must be an investigation planned, and if it's a work-acquired condition, there must be a standard operating procedure. That's what that SOP stands for, so that you know how to deal with somebody that could possibly have contracted the infection at work whilst doing work. Sharing a Zol or sharing a cigarette at work and contracting COVID-19, it happens at work, but it's not a work-related incident. So there's a difference there, and hence that number 4 investigation is in place. What's the non-compliances we see is, I've been through there so many times now, sick employees still at work. Compliance officers are not really managing this aspect here. You know, it seems to dwindle somewhere away. There's no investigation done. If somebody reports an illness, Work-acquired C19 is not reported and say, you know, well, you can't prove it. Well, the reporting itself is part of proving it. It's not for the employer to decide whether it's work-acquired. It's not for the employee. It's not for the safety officer. It's not for the occupational medical practitioner. It's for the compensation fund doctors to decide whether the evidence presented to them is a work-acquired case or not. That's explicit in the guideline from the Department of Labor. And then the last one, of course, is, you know, this all these particularly government places where if the workplace is closed down because there was a COVID case, they all keep getting paid. So, you know, that's not on. You don't have to close a workplace because there was a COVID person in there. So that's also an abuse of our system. Other things that you see is, we said that just now, the risk assessment must be updated. I mean, our probability has changed tremendously because we've got this low prevalence and this low positivity rate. You need to see that somewhere in there. But we need to also have a look at the possibility that children and people at home have become a new change. Vulnerable employee identification is not really done properly, or the vulnerable employee management is not done. If you've got hypertension, diabetes, if you're over 60, you must stay at home. There was a whole group of mines that actually chased contractors away because they were over 60. That's totally unnecessary, and it is unlawful. It really is unlawful. You know, vulnerable employee management goes about, a vulnerable employee has got no more probability of catching COVID in the workplace than your fresh bull. The probability remains the same. It's the potential severity of catching the disease. So if you've got a safe workplace, then the vulnerable employee can work there. But the hierarchy of risk control determines that you first avoid the risk. So the risk avoidance is if the vulnerable employee can work from home and can be equally productive by working from home, then that's what you organize there. And then obviously, you know, contractor and visitor management, you see that in pubs, you see that in restaurants, you see that people are doing things that they shouldn't be doing, but the owner is just too scared of chasing his clients away. Just a short word on vaccination in the workplace. You've seen, you know, these things come around. The employer will force people to vaccinate. You must be vaccinated. You know, I refuse to be vaccinated. There's a whole bubble on this vaccination. I haven't got an answer here. I think, you know, maybe Ashraf will invite us to have a talk about this. It's complicated. You must watch this space. But there are some questions that you need to raise for yourself, you know. So in occupational containment, what is offered if people are vaccinated? Will the vaccinated worker not get infected? Well, you can see that for yourself. Some of these vaccines are only just over 50% preventing infection. So that question is answered. No. Can the vaccinated worker not infect another? There's no evidence for that. I'm not saying it's not the case, but there's no evidence for that. Does the vaccinated worker, can he now say, well, no more masks for me, no more social distance for me, I'm not washing my hands anymore, all non-pharma controls don't apply to that anymore? Lawfully, no, but we don't know. Does a vaccinated worker offer a herd or our president's word, does it offer an occupational or a community immunity? We don't know what would happen if employer A had all their employees vaccinated and employer B didn't. Question 2 is if there was sufficient evidence that vaccination is, let me take you back to Michelle Morgan's word, reasonably practicable, those 4 things. If it was reasonably practicable that we must do it in the occupational setting, why can it then not be compulsory in society at large? And then the last thing is, you know, what's going to happen to the vaccinated cohort? You can see in Europe, you already get like a vaccination passport, and certain airlines are talking about you could only fly if you've got a vaccination passport. So these are the questions that are remained open for that one. I really don't want to bring a dark line to the end of my talk, but this is Dr. Kluger from the World Health Organization in Europe. In 4th of March, he gave a speech and he says, you know, what we're seeing is new cases are rising by 9%. there's a resurgence. I hope we don't get this in South Africa. I sincerely pray and hope that we don't get this. But his answer to is we need to get back to basics. And this is why I put this thing here, is we are at basics. So let's keep testing. Let's keep isolation. Let's keep tracing. Let's keep quarantining contacts. Let's stick to prevention and control. Let's keep on engaging our communities. Like here, I saw there's like more than 500 people watching this. This is great. Let's counter pandemic fatigue. And let's assist with an accelerated rollout of vaccines. We don't have to look at this thing as something that we should have done or something we must now do and get back to basics. We are in basics, and I think we should stick to the basics. I thank you. This is this list of compliance that you can get. So it's a very long thing. And essentially there were 2 laws left over, and I'm going to end with this. There were 2 laws left over that left in an occupational health and safety environment, not in a mine environment. There was the disaster management regulations of the 28th of February, and there you will see them in blue inside this thing. And there were still the 1 October consolidated directions on occupational health and safety measures in there. Thank you, Ashraf.
Thank you very much, Dr. Jan Lapierre, occupational medicine doctor and independent occupational health and safety consultant with specialization in a social labor law. And you could clearly see the evidence of that integration of knowledge. So Dr. Lapierre is a Health Professional Council South Africa registered occupational medical practitioner with special interest in chemical and pharmacological occupational health and safety. He's also the SACP CMP, that's the construction sector, a registered construction health and safety agent. There are 2 levels below that. I think it's the manager and I think the officer. So thank you very much for that, Dr. Lapierre. There are some questions I'm going to direct you to on our Q&A box. Please, if you could just give some attention to that there, because it emerged as you were speaking, and I think it might be directing to you. In the meantime, that particular checklist that Dr. Lapierre spoke about will be part of the email that we will send to you with all the links for the presentations as well. So it will be uploaded, and the link to the presentations and that particular checklist will be circulated to all of you post-webinar. We try to do a turnaround time of somewhere between 24 hours and 48 hours as a maximum, depending if the angels of technology and IT and websites and all those other things work with us closely and watch over us. But we will definitely get that to you. I will also remind you that there is a red cap post-webinar survey, and this survey particularly will ask you to evaluate the content and the presentations, etc., of this particular webinar, and for you to suggest any other topics that you would like the webinar series, the COVID-19 webinar series of the National Institute for Occupational Health to incorporate, and the committee will give your recommendations and request serious consideration or incorporate it in one or other topic. And then finally, critical, please visit our website, that is www.nih.ac.za, www.nioh.ac.za, and on our website are all these free resources, our presentations, a whole lot of other resource informations and sheets, etc., etc. And Dr. Lapierre has also made a reference to quite a number of those documents on the website. Our website is 0 rated, which means no data would be charged for you through any of the major mobile service providers and internet service provider. And if you have your employees' Wi-Fi, shouldn't be an issue either. So a thank you, a very big thank you to our panel today, and that's Dr. Graham Chin, who is the occupational medical practitioner in the National SHE Department, the Safety, Health and Environment Department of the NIH that serves the larger NHLS. And thank you for sharing his wealth of experience and information with us. His colleague in the SHE Department, the Deputy Manager, was Michelle Morgan, and she had dealt with legislated roles and responsibilities for employers. And that was followed by a colleague of ours in the occupational hygiene section, and that's Karen Dupree, and she dealt with what employers need to implement in response to COVID-19. And then finally, as you've just had the input of the very useful, and lots of compliments for our presenters in the chat box, I noticed as well, was Dr. Jan Lapierre, who's an occupational medicine doctor, and combined with that, a lawyer as well. So you have this integrated inputs with regard to the responses, and you could see the wealth of that experience and knowledge in the presentation as well. Dr. Lapierre dealt with the employer's COVID-19 containment in practice, and as you can see and notice that his inputs was well supported by quite a lot of practical experience in different sectors and industries. So thank you very much to all of our speakers. I'm going to ask our speakers just to have a quick look at the final list of open questions in our question and answer box. I'm going to ask you as attendees, please not to add any new questions. If you have new questions, please email your questions to, that's info, I-N-F-O, info@nioh.ac.za. That's our email address for our COVID-19 webinars. It is info, info@nioh.ac.za. Please send your questions there if you've got further questions that you might want answered, and I will ask our presenters if they would be willing to look at any questions that come in post-webinar. But for now, those questions will be answered. I think Wayne Fortuin, thank you. I will just remove sorry, your question there, and then be down to 2. I can just send that one. Oops, I might have answered the wrong question there. So a final reminder for you, next week we are actually, to tell you before the notice have gone out, we have, in fact, the notice for the National Department of Employment and Labour's launch of the new regulations for hazardous chemical agents have been sent out already. So next week, Tuesday, we are hosting the National Department of Employment and Labour, and they'll be launching the new regulations on hazardous chemical agents, the 2021 version. Please join us next week. If you've not yet received your notification or invite to that particular webinar, you can ask us at info.nih.ac.za, info.nih.ac.za, that email address, and ask to be sent the invitation. And then on Thursday next week, we are having the topic of long COVID, and our colleagues in the occupational medicine section of the NIH is still working very hard at ensuring that we have that topic sorted. That is Thursday next week. So we have 2 webinars for next week. That's the end of this particular webinar. I'm just going to briefly play the slides for you. And so thank you for joining us this week. We will see you in our next edition of the NIH's COVID-19 webinar series. Goodbye.